Omnicuris, India's largest online CME platform, in collaboration with the Indian Orthopedic Association, bringing you the accredited latest digital CME on ortho learning and assessment.
Hello everybody, I am Dr. Chaddha and I shall be speaking to you about management of P.I.V.D, Prolapsed intervertebral disc, commonly referred to as slip disc. A few people even call it lumbago associated with sciatica. P.I.V.D is basically a degenerated disc which is causing pressure on a nerve and causing symptoms due to irritation or compression of the nerve in the lower back. Do we do a CT scan? Do we do EMG nerve conduction studies, electrophysiology, discography? Should we give root blocks? Should we do a rheumatological or a metabolic workup for vitamin deficiencies, arthritic markers? Well, all that was done, and yet, despite medical management, the gentleman was unhappy. Well, he does need decompression. Do we do a fenestration? Do we do a laminotomy? Do we do a complete interlaminar discectomy, or do we do a multi-segmental laminectomy? That's where I am. L3-4 micro decompression, L4-5 decompression with a soft stabilization. The device in between allows physiological movements but prevents supraphysiological movement at the L4-5, and at the lowest level we do an instrumented fusion. There's probably an internal disruption, an annular tear, a loss of disc height, and then a prolapse. It can happen to young adults. It can happen to the middle-aged. It can even rarely happen in the elderly sedentary. There could be repeated leg pains with back pains, and in the elderly, back pain with claudication. We do X-rays, MRIs, where necessary CT scans, electrophysiology, even at times discography, and in all patients, a psychosocial evaluation. How do we treat them? They all need miracles. Minimal invasiveness, risk and cost having a lasting effect. We need to treat the man and never the scan.